I'm a urologist, and here are 5 things you should know about Macrobid or nitrofurantoin. 1. What does it treat? This is a urinary antibiotic. It is concentrated in the urine. It's not good for much else. So it treats bladder infections by interfering with bacterial DNA. It does not get really good concentrations in the tissue, so it wouldn't be good for a prostate infection or a kidney infection, but it's concentrated in the urine, so it is good for a bladder infection. 2, if you are severely ill, meaning you have fever, chills, nausea, vomiting, pain in the side, symptoms of what we call pyelonephritis or a tissue infection of the kidney, this is not a good antibiotic because it does not concentrate in tissue. 3, let's talk side effects. So for short-term use for a bladder infection, nausea and headache are going to be the most common. The nausea will usually be improved if you take it with food. For long-term or what we call suppressive use, you need to know there's a small risk of liver and lung inflammation. And in rare cases, the lung inflammation can lead to pulmonary fibrosis, which can be a debilitating disease. 4, let's talk dosing and duration. For an uncomplicated bladder infection, 3 days of macrobid or nitrofurantoin is appropriate. If it's a complicated bladder infection, we might use it for a little bit longer. For suppressive use, we usually use a lower dose of something called macrodantin, which is usually 50 milligrams, and this is to prevent, not to treat a urinary tract infection. And 5, it tends to be so reliable because resistance to E. coli is fairly low. Because it doesn't concentrate in the stool where E. coli lives, there's not a lot of opportunity for resistance. So you might see a 5% resistance rate with E. coli with Macrobid, while it could be 20% with Cipro or Bactrim. So to summarize, great short-term antibiotic for bladder infections. Take it with food to reduce the risk of side effects. And if you're going to use it for a longer duration, know about the rare but serious side effect of pulmonary fibrosis.